At KSMO Radio, it's time for us to sit down with our friends from the Salem Memorial Hospital. Our spotlight on the Salem Memorial Hospital features today Mr. Bobby Sullins from Radiology, and I happen to see Bobby up front and close and personal a couple times in the past few months. How you doing, my friend?
Good. Good morning.
Very good. It's interesting how much you learn about yourself from radiology. I mean, a lot of people say it's just an x-ray or it's just an MRI or an MRA or whatever it might be. And they say, well, what can they tell out of that? I was amazed at what they can tell out of that. Bobby, tell us a little bit about that.
Well, I mean, imaging in general is just we help diagnose the things that are going inside you. So as we know that we have different modalities, x-rays show differently than a CT or an MRI. You may go to your doctor and think you're going to get one set of tests and have to get further additional testing. That's why these multimodalities are so important.
But the neat thing about it is that with the equipment Salem has right now at our hospital, small, local hospital, I mean local, is the images that come out, and then when they are being read, the people who are reading these actually are getting a very good idea of what you have. You know, years ago, we used to have a mobile mammography unit, and we used to have a mobile MRI. Not take anything away from it. That's all that we could afford at the time, right?
Right.
Well, now we've got these in-house. We've got the latest and the greatest. And I want to tell you something. That will help save lives, and it will help diagnose a lot better for what you actually have, because the pictures, the images, they're clear.
Yeah, and also, Stan, I mean, the main thing with radiology within Salem Hospital right now is we have the ability to be able to give our patients, full access. We work with their schedules. These are read by professional radiologists out of the St. Louis group. We can transfer images by a click of a button to anywhere we need to. So we try to eliminate every hurdle, every obstacle for patients not to want to come to Salem. We're cost effective.
Very cost effective.
We work with your schedules, as I said, and our imaging is, I mean, our CT machine is 18 months old. MRI is the open bore MRI. Ultrasound has been all upgraded, so we're hitting on all cylinders right now.
Yeah, and like I said, I had the opportunity to introduce myself with some of that machinery.
Oh yeah. We gave you the VIP.
But I'll tell you, and here's the interesting thing. You talked about the open bore, and the very first time that you kind of stuck my head underneath there, you get that cramped in feeling, but you realize you actually have some room. There are MRIs out there that you will actually feel like a sardine in, won't you?
Oh, yes.
That look you gave me.
Yeah, that's for sure. I know that the latest research states that like about 15% of patients cannot receive an MRI due to claustrophobia.
Yeah.
We get the open bore MRI, and that cuts that down to 5 to 8%. So even if you are hesitant towards it, I mean, my rule of thumb is we're going to stick you in there. You say get out, we're going to get out. But the doctors are really good about maybe giving somebody some kind of mild sedative or. And I think we do a really good job about explaining the procedure, trying to take the anxiety away.
Right.
And ultimately, just we want to get the best images for the patient. We understand good communication is always key and vital. What's up again?
And your little questionnaire beforehand obviously sets the stage. If somebody is claustrophobic, it's on there. You can just put that on there, and then they'll talk to you about how claustrophobic are you.
Sure.
Do you realize you actually have some room to your sides? Now, of course, I think when they strapped me in where I had to keep my hands to my side, it makes you feel a little closer because
Sure.
you're in that, I'll say gurney because I don't have a better term for it.
Yeah.
But you were doing an MRI on my head. I couldn't move. So I understand exactly why it was done that way. And it was not a big deal. Just relax. I just said, okay, just close my eyes, relax, start thinking about something else.
Yep. Find your happy place.
Yeah. And it really is easy because you hear a few things. The headphone one, I thought, I liked it better the first time when I did have the headphones on.
Oh, really?
Well, I could hear everything going on. Then you get that muffle sound. You know how it is in your head.
Sure.
And I felt more in tune with it the first thing. It took about 25 minutes for the first MRI they had, and then on the kidneys and stuff. But it's a complete diagnostic picture of what's going on with you. And that's what I really loved about it. You guys are sitting there talking to you, always making sure you're good to go. Some hospitals, they stick you in there and just turn it on and they kind of walk away.
Forget about you. I mean, we've all been patients. I've been a patient as well, and I mean, you ask me to go to the dentist, I'm going to be anxious. I mean, I just am. So I do believe that communication is key, and a lot of times people don't know if they're claustrophobic until we get them started.
Well, true.
And as I said, we just myself, we put them in. We get them comfortable. We tell them about the procedure. Everybody has their magic squeeze ball that they can, as soon as they squeeze it, I'm running out and pulling them out and having another conversation. But ultimately, patients don't really have that much trouble.
No, and this is the key, and that Salem Hospital has gone out of their way, to some great expense, as a matter of fact,
Yeah.
to bring these services to our local community, which there's not many small hospitals that have this type of imaging.
No, there's really not. I mean, we could have, the hospital could have went with just a normal, closed bore, tight MRI, but they're thinking about patients first.
Yeah.
Like our CT machine, it's fast and it's good and it's diagnostic, and they could have went with the cheaper route, but they decided not to. They decided to go with the route that best serves our community. And so they've done that. They've really invested heavily into the imaging side, and we do our best to try to make sure that the community is taken care of.
One of the things, Bobby, I wanted to bring out is because I've had an opportunity to go to a lot of different departments in the hospital lately, from ED all the way to nuclear med,
Right.
and they all work together seamlessly to try and work together, because if you have this exam, or maybe you need to go see nuclear med, and you got to come out and you got to go here and you have to go here and then go into maybe getting a CT, or maybe it's an MRI or MRA or whatever it is. I know one time I actually had an interview here and I couldn't get away. I was supposed to be there at 2 o'clock. I said, I'm going to be a little bit late. I called the hospital. They checked to make sure I could still get in. And they said, sure, come on down. We're going to get you in. If we have to stay a little extra, we'll stay a little extra. That service is service you don't get when you go to a big hospital. If you're not there at 2 o'clock, you just missed your appointment.
Yeah, I know there's a lot of places, if you're 5 minutes late, they're going to cancel your appointment. But we want to take care of people. That's number one. And so we will, if we have to reschedule or push your time back, we'll do whatever we have to do to try to work through your schedule and fit you in.
Our imaging department, Bobby, might explain, we really have some fairly new equipment in all aspects of our imaging, don't we?
Yeah, we have. Of course, we do the standard X-rays.
Sure.
And we have a machine called DEXA bone density, which is a screening tool for osteoporosis.
Right.
We have.
People might remember that from the old health,
Yeah. Right.
clinics where they would take you in and check your bone density.
Yep.
Mm-hmm.
We have full service ultrasound that also includes echocardiograms. We got the CT, which is, it has a 650-pound weight limit. It's a massive CT. The MRI, we've already talked about it.
Right.
We offer a nuclear medicine service as well, which they do cardiac stress tests and bone scans.
Had one of them?
Yep, they do those. And so then we also have our 3D mammography. So, we're really fortunate to have the equipment we have, and we're also fortunate to have the personnel we have. All of our personnel, we have registered people in every modality. We have, everybody, of course, is registered in X-ray, but then we have our subspecialties. We got, 2/3 registered in CT. I got a couple registered in MR. We got registered ultrasound techs, registered mammo techs. So we're really, you can check the box on credentialing, you check the box on equipment, check the box on price transparency, on scheduling. We want people of this community to use us, and we will do the best service we can for them.
Let's get back, though, to the product that you deliver, because the images are what it's all about. Obviously, the patients are very important, too, but if you've got trained physicians trying to interpret these results, and you don't have clear pictures, you've got fuzzy ones or maybe very pixelated pictures, it's really hard for them to make a diagnosis, isn't it?
Oh, sure. If you were running, I was taking a moving capture picture, it'd be hard to tell what type of shoes you're wearing.
Right.
The radiologists are extremely trained, and they do not accept any images that are below standard. And so our job is to not only make them above standard, but to make them exceptional. And so I think we really do a good job about that. There's constant communication back and forth between us and the doctors, and then also us and the ordering doctor. So we're kind of the middleman. We just do our best to make sure all people are happy and those patients get accurate results.
And the radiologists seem to really enjoy. When I talked to actually a cardiologist up in St. Louis. He said, he goes, these are some of the best images that he's ever seen. And he's in St. Louis.
Yeah,
I mean,
we do get that. I mean, it seems like bad news travels better than good news, but the feedback that we get is almost always positive, and I don't even mind having a negative feedback because that gives us opportunities to grow and to learn. And so we have the equipment that to do the job. We got the personnel to do the job. And ultimately, we're here to make the patient. We got two customers. We got the doctors and we got the patient. So we're going to make sure that they're both taken care of.
And the neat thing is, these radiologists, when they put out, and especially with the new portal that Salem Hospital has, and I'll give a little plug for it as well.
Yeah.
You get to read what the diagnosis is. They're putting it down in maybe terms that you're not totally familiar with. Because I had an extra artery going to my kidney. It was kind of interesting to find that
That's
out.
wild, ain't it?
Yeah, I'm like. It was kind of interesting because he's abnormally normal,
Sure.
And it's like abnormally normal. I mean, what kind of does that mean? But everything was good. Everything was fine. So nothing was out of place. Everything was in tolerance, and it's where it should be. That's great. And then he goes, he has an extra artery going to his right kidney. And I thought, well, kudos for me.
Yeah, there you go. There you go.
Because I got extra filtration. I'm really good, man. I'm going to be flowing good. But, these are things that they note in the notes that you actually can read on your portal that
sure.
comes back through. But it's so nice to see that these readings, and years ago, Bobby, sometimes, and I'm talking quite a few years back, you might go get an x-ray, you might go get a CT, you might go get an MRI. It may be 2 to 3 weeks.
Oh, yeah.
Before you would get a result. And in the meantime, you're still in question. You don't know if this is right, don't know if that's right. It was back within, I think, the next morning I had it, and it was a late afternoon that I was there.
That's typical,
and I think it was actually back late that evening. It's just it wasn't on my portal until the next day.
Yeah, typically the turnaround time is very good for our imaging. But that's what's great about being in the 21st century. We have technology now. I've been around. I started in the hospital in '99, so I'm closing on 25 years, which is kind of crazy.
You don't look that old.
I started when I was young and knew it all. But back then, we had to have a radiologist come in, drive in from St. Louis. He would read all the X-rays, so you wouldn't have a radiologist even looking at a film except for just a few hours every day, and he'd have to drive in. Now it's literally a click of a button, and they can be transferred anywhere. The doctors read them, reports go out, they go right to your phone, to the patient portal. And so it's pretty seamless now.
Yeah.
They make it so much. The technology has really enhanced all medical, but especially imaging.
Well, that doesn't mean, though, you still don't go talk to your primary physician about those results, because there are still some other things you may not totally understand in the lingo that they use.
Stay away from Dr. Google, I'll tell you that.
And WebMD is not always your friend, because you'll have every symptom that is known to man underneath that one category,
Sure.
and you'll have 15 different diseases you don't even know that they exist.
Yeah, I don't even try to read these reports and self-diagnose. I can't do it. I go to my doctor too.
Yeah, I'll bet you. And the thing is, though, what we're trying to say is you've got a quality hospital here with quality imagery. If you need to get something done, X-ray, MRI, CT, mammogram, you don't need to go anywhere else. No, 2 reasons. Number one, the best equipment's here.
Yeah.
Why go somewhere else? Second, it's cheaper than anywhere else.
Sure.
To get it done here. And you can call Central Scheduling, and you can find out how easy it is to schedule that right here in Salem.
Yeah, Central Scheduling takes care of if you need an exam scheduled for imaging, contact Central Scheduling. Their number is 453-5952. 453-5952. You'll talk to scheduling. They'll get it. They can even contact your physician to get the order.
Mm-hmm.
Sometimes there's the most frustrating thing is this pre-certifications for insurances. The ordering doctor is required to do the pre-cert.
Right.
And so sometimes there's some back and forth, and that could be a little bit of a delay, depends on how.
Depends on your plan.
Depends on the plan, yeah. But ultimately, we have other options too. We have patients that have no insurance or a high deductible. We do have a cash price option that gives patients the ability to be able to just pay a cheaper cash price for up front, and and go that route. But we have different ways. So if you need something, scheduling does a good job about giving you different options.
So don't think it's prohibitive where you don't want to go get that service, because trust me, if you do something to your knee or shoulder and you need an MRI or you need to get a CT, you need it. Don't sit there and put it off, because it's not going to heal itself.
You got to get fixed.
Well, especially in these times, because you could actually do more damage, as well as I do. If somebody get out there and have a separated shoulder or something else in that nature, and they're not getting it fixed properly, or they've got some issues with the shoulder, maybe it's some cartilage up there that they've ripped out. Hey, you can't tell. And I mean, I know I've got some issues with some throwing too many curveballs when I was younger. It does happen, and you tear a few things here and there, and over the time of your lifetime, it scars up. And you think you can go do that again, you go out there and you end up ripping some of that scars apart. It's not always the best thing to do.
Definitely not.
We learn as we get older, sometimes not the right way.
Yeah, I mean, that's why it's always important. If you do have an issue, go to the doctor. Your doctor will evaluate you, and if they decide you need further testing, I mean, come on over. We'll take care of you.
Absolutely. You guys do a tremendous job. I want to thank you and your entire staff. So all of them do it, from the mammograms all the way down. Sam and all them over there do a fantastic job.
They sure do.
And everybody's super friendly. And if you got questions, they're more than happy to answer them. They want you to feel as comfortable as possible. They know this is not something that everybody looks forward to going inside an MRI.
Absolutely. Yeah,
get
absolutely.
An MRI or an MRA or whatever it might be that you need to get. But trust me, the results that you get from it, that you're going to get the instant feedback right away. You get to your doctor, they're going to tell you how you're doing. I was in with high blood pressure, and we checked virtually everything that we could to make sure, try to find out why, and nobody found a thing. The nice thing is, though, is you find out about your circulation and find out about different things that you may have doubts about, just as an individual. I'm getting up there a little bit in years, and when you hear about carotid arteries and getting clogged and stuff, and you don't know, you have no idea, and then all of a sudden, you got a blood pressure spike, you got something else going on. What goes through your mind? The unknown. You're always thinking on the worst.
Right. Well, early detection is key with anything. I mean, a lot of times if it's detected early, it's very easily treated or taken care of.
Or if you go find out that there really is nothing there. Maybe it was just one of those weird things that happen once in a lifetime, you know. But at least you know.
Yep, you're absolutely right.
You know, that's a treatment in itself. Bobby, thank you very much. Bobby Stelling from Radiology. We really appreciate it. You guys do a fantastic job. And again, if you need radiological services, any kind of imaging done whatsoever, you will get it done the best here. It's better images than any hospital. I think within 150 miles, you guys have the newer equipment.
Yeah, we're solid.
And they can give you great imagery and at a much reduced price over where you might go elsewhere. Think about it. I'm not saying that don't you go check it all out. Everything is pretty much transparent. I hate that word, but transparent today. But if you want to price it, you can.
Yeah, you can. Every hospital has a price transparency tool that's on their website. And so you can see what somebody, if I was going to buy a new car, if I'm going to buy me a new Ford, I'm going to, different places to price it for the same Ford. And so if it's economical to stay local and that's what you want to do, then hit us up.
Now, once you find out the order from your doctor, you can compare it to any hospital, but make sure you're comparing apples to apples.
Yes. Yeah. That's right.
There are different tests that are done, and they do have different codes, so make sure you're getting the right one.
Absolutely.
Bobby, thank you for your time.
Thanks,
always appreciate it, and look forward to seeing you again soon. Happy Valentine's Day to you
too. Yes.
And hope you have a fantastic day today.
I will.
We have civic happenings coming up shortly. We invite you to stay right here, KSMO.
God, I'm so stressed.